Now, as more hostages are being released, we'll be hearing a lot more about how they're adapting to life outside now that they're free. They face a lot of conflicting emotions. There's the joy, of course, of being released, but the grief of what they've witnessed and the people that they've lost, as well as the other hostages who've been left behind and the guilt that comes with that. Neil Greenberg is a psychiatrist and a hostage expert. He's also a professor of defense mental health at King's College in London. He's joining us today from Mexico City. Professor, thank you so much for making time for us.
Good afternoon.
Professor, what do you think the mental health experts and the psychologists and psychiatrists who are greeting these hostages at the various hospitals are asking of them, and what exactly would they be assessing at this point?
Well, I think it's really important to recognise that anybody who's been in detention for any period of time is likely to have found it very frightening. They're likely to be distressed when they get released, and also readapting back to life can take a bit of time, and it can be disorientating. So at the moment, I would very much hope that the primary focus is not to make them into a mental health patient. So I wouldn't expect that mental health professionals would be treating them as a patient, but what they might be doing is to be there to support them, to give them some general advice, to sort of map out what the likely pathway is going to be for people as they begin to readapt. And I think it's important to say that information also needs to be given to family and loved ones, because the way they deal with the hostage and bring them back into their family, into their social network, very much depends on how the hostage does. So I think they should be getting some information, setting out what might happen, and then gently and relatively informally, they should be having a chat with them just to make sure that they're going along the right pathway. Because in the first few days and even the first few weeks or months, it's quite usual to have nightmares, to be distressed, to be jumpy, to be distrustful. All of those symptoms are very normal, and they don't by themselves indicate that a hostage or an ex-hostage is ill. Inevitably, though, some of the people who will have been in detention will go on and develop mental health problems. And what's important is that they're monitored in a general way, so that if they do develop a mental health problem, they can get formal treatment early on.
What are some examples? I mean, 50 days in captivity, not knowing if you're going to live or die or if you're going to see your loved ones ever again. What does that fundamentally do to a person? For example, what are some cases you've seen?
I've seen a wide variety of people, some of who have been kept for days and some who have been kept for many years in captivity. And I think it's very difficult to describe a single pathway for how people recover. But what we know is that some people are very good at switching off, because they can't control what happens to them in captivity. They distract themselves, and other people spend all their time focusing on what might be the very worst outcome for them and their fellow hostages. It really does vary a lot. I think what's important to recognise is that when people come out of captivity, there isn't a steady pathway where everyone recovers. There can be days when absolutely you're on top of the world, and there'll be other moments where actually it all seems so complicated that actually being back in captivity might even seem attractive, because at least that existence was simple. So it's fair to say there is a wide spectrum of responses.
Let's talk about children in particular, because they've been such a key focus. And of course, the hostages being released, many of them are young children. We're talking about a young girl who's now left orphaned. And I don't know if she knows that. I imagine by now maybe some family member might have told her that both her parents were killed on October 7th. But what are some specifics we need to keep in mind for the children that are being reintegrated?
So first of all, it's important to say that I'm not a child mental health expert. My adult mental health is my expertise. But in terms of children who have been taken hostage and who go through any traumatic event, the most important aspect, particularly for the younger children, is the way that the adults around them respond. And so even if they have to be given the most terrible of news, if those adults around who care for them and hopefully love them, give them the right support and allow them space to talk about what's gone on for them and what's happened, that's really important. Children also tend to not report psychological symptoms like intrusive thoughts or feeling distressed in the same way as adults. They often have symptoms that come out in behaviours. So they often behave in a way that might seem to be concerning. But as long as the adults around them provide a stable base of care and support, then again, that maximises the chance that they won't become unwell. However, again, if they do become unwell, if you spot that early on because they're behaving strangely and things aren't improving over weeks or months, there's good evidence that treatment to deal with that sort of trauma can have a really big positive difference for children as well.
Okay. Professor Greenberg, before I let you go, and I completely recognize that your area of specialty is adult psychology or adult help, but I would be remiss if I didn't present a question from our guest last hour. Zaman Abdullah, his wife and his 4 children were in Gaza for the entire war. She and the children just escaped into Cairo, and now they're back home. What he's noticed with his youngest, his daughter, Maria, is that every time someone mentions Gaza, she jumps. And he says that she has, anytime they suggest, well, maybe one day we'll go back, she says, no, 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 I never want to go back. And she's talking about words like bombing. And so she's very, as a preschooler, aware of the concept of war and death, and he doesn't know how to manage it. Any advice for him?
Well, I think at these early stages, if she's still eating, being nice to her siblings and getting on with her parents, even if she's crying and talking about these long-term permanent sequelae, then I think the thing is to support her and give her space to speak about it. If her difficulties continue for more than a month, then I very much would advise them to speak to a professional about what's going on, because if a child has got mental health problems, then again, as I said, there are some really good treatments out there that can help them. But I wouldn't jump too quickly into treatment. Often the greatest healer is time, and if that time is with adults who love and care and support her, then hopefully, fingers crossed, that she'll be a lot better.
Really, really nice advice. Neil Greenberg, thank you so much for your time, sir. Take care.
Take care. Thank you.